Dear all valued friends, welcome to attend today's seminar. This is William from Plum Medical. And before the clinical demonstration, here I'm very glad to be standing here to give you a brief introduction about this model, the interventional flat panel detector CRM system, PLX7100A. And for this machine, it can be widely used in peripheral vascular diagnosis and adjuvant therapy, and is often used in interventional hematology, respiratory, and other departments to carry out the vascular interventional surgeries. At the same time, it can be used in the orthopedic interventional surgeries or gastroenterology, gynecology, urology, and other departments to carry out the current-type interventional surgeries. So you may wonder how this machine can realize such wide applications. So now let's move to another part. I will show you how it can realize this. So for now, I will show you how we can realize such wide application. First, on the one hand, is the spatial and powerful image chain. For this machine, it comes with a high-frequency, high-voltage generator with 25 kV output power to ensure more stable and high-quality X-ray source from the very beginning. And the rotary anode with a dual focus, small one 0.6 and the larger one 1.3 millimeters. And the thermal capacity can reach to 1000 kilojoules, so it means it can meet the high-intensity exposure needs and to ensure the long-time interventional surgeries performed successfully. And for the flat panel detector, we use large size 12 times 12 inch Thales dynamic flat panel detector, which the size is the biggest in the market, and it can provide you large field of view and best quality images. And also for the large human body part like the abdomen and the lumbar, once exposure can cover the whole human body part, so it can reduce the unnecessary radiation dose caused by the repeat radiation dose, which can make a good effect to protect doctors and patient health. What I also want to mention here is that there is a lifting range of the flat panel detector. So it means the flat panel detector can be left up and down. And so during the operation, the FPD can be much closer to the patient, so that it can help you to reduce the magnification, so that to provide the best quality of the images. And here you can see is our workstation. It's equipped with two 21-inch 2 mega medical grayscale screens, and also it can be rotated at a large angle, so it can facilitate the users to observe the images at different angles. And also the standard COM 3.0 interface is also available here, which can easily to connect to the hospital PAC system and realize the information sharing and the collaboration between different departments. Okay, about is the first part about the powerful image chain to ensure you realize such a wide application. And so now let's move to another part, how we can ensure you the wide application. Now let's move to the second part, is about the powerful and spatial functions about this CRM system. Firstly, the PLX7100A equipped with a remote grid, which can be easily moved by your hand, which plays an important role in those sensitive patients like the children and elderly. With this design, we can not only provide you high quality images, but also with very low skin dose, so that it can make a good effect to protect doctors and patient health. Second, the CRM frame adopts 5-dimensional electric control, and here are some buttons in the CRM system to help you to control the mechanical movement. And you can see when I push these two buttons, the CRM can be left up, and also it can be left down. Totally here the movement range is 400 millimeters. And second is the C-arm can be moved. You can see the C-arm can be moved forward. Also, the C-arm can be moved backward. And the next one is that the C-arm can slide along the orbit. You can see when the C-arm can slide along the orbit. And totally the range is 120 degrees. Next one is that the C-arm can be rotated. That means it can be rotated in a circle. That also means it can be rotated by 316 degrees. As you can see, it can be rotated. Because the table is looking here, so I will not show you the full circle. Just show a little range of this. As you can see, here is the four-dimensional mechanical movement, and the last one is what I have mentioned before. It's about the lifting of the flat handle detector. All this five mechanical movement is designed to help doctors to set the position very easily and quickly, greatly improve their work efficiency. For the third one, you can see here it's equipped with two 10.4-inch human body graphic touch screen. With this touch screen, it can help you to realize more functions, and you can see you can help you to choose different working models, and also it can help you to choose different human body parts for exposure. And when you choose the one exposure body part, the parameter is set. But the doctors can change the parameters according to their experience. You can see he can change the parameters according to their experience to ensure that it will provide you the best quality images, but also with the most suitable parameters. Except the control panel, here also it is equipped with a backside controller. With this, it can also realize some operation and functions like this touch screen. It can also help you to choose the working models and control the mechanical movement. And more important is that when you need to do the operations, you do not need to go into the CM system to realize this operation, like the mechanical movement or the parameters setting. You can just stand near the surgical table to achieve these operations. And more important is that it's equipped with some DSA roadmap, landmark, and these functions to help you to meet the DSA imaging requirement. And for this part, later our specialist Aaron will give you more detailed information about this part. And also, you can see the CM can be linked with the DSA injector. All this is to help you to realize the DSA imaging requirement. About this part, lecturer Aaron will give you more detailed information. Please keep an eye on it. Okay, that's all my brief introduction about this CM system, PLX7100A. Thanks for your time and thanks for your listening. And next, we'll move to another part. We are very honored to invite our marketing specialist, Mr. Aaron, to give you the clinical demonstration. Let's welcome.
Hi everyone, my name is Aaron Zhang, the marketing specialist for Product Medical. This is my partner Chen Tang, the senior imaging clinic specialist. Today we're honored here to give you a digital subtraction intraoperative stimulation for the CLX7100. So as you can see, we have a dummy plastic attachment on plastic tube on the table, which will be demonstrate how the enterography works later. And as you can see, I'm now wearing a lead apron, which means I'm going to operate in the observational by using tube expansion wireless. Also, we have a DSA injector. The syringe is filled with contrast media and will be automatically goes into the plastic tube to show how the subtraction is done. Of course, we also have a paper control tablet is shared with the same interface as the C-arm, as the touchscreen panel on the C-arm. So you can see you can have radiography or fluoroscopy. But the most important, it has DSA options. That means the doctor can proceed a DSA operation right beside at the table. So that's all about the C-arm. If you're ready, I'm ready. Let's head to the observation room for further operation. Alright, ladies and gentlemen, we're at the observation room. You can see we have 2 expansion monitors right here, which we can operate the C-arm right to the workstation. And also we have a foot switch for the exposure control. So as you can see, this is the interface for the C-arm workstation. You can have your patient file management right here, or for image capture, or image editor. So let's create a new file for first. Now the first thing we can do is to take a fluoroscopic image. So we can press the yellow paddle of the foot switch. Now the fluoroscopic image is done. Next, choose DSA option, and then press the blue paddle of the foot switch. So the contrast media goes in, and the bone disappeared, leaving only the blood vessel behind. And that's for all the DSA simulation. So that's all about the DSA feature for this CR. Before the end of the demonstration, I'd like to show you some of the clinic images taken by the CR and explain to you what kind of CR can apply to. So as you've been told before, the 7100 has a maximum output power of 25 kilowatts, which means it can be capable for participating in most of the peripheral vascular interventional radiology. So what you see right now is the subtraction image of the iliac tract artery. You can see the contrast agent goes through the internal and external iliac artery from the right common iliac artery. During this subtraction, the ilium and sacrum disappear, leaving only the blood vessel behind. And this is an image of a renal arteriogram of the left kidney. In this angiography, an incision is often made at the iliac artery or the femoral artery, then use the catheter to advance through the aorta and arrive at the renal artery. Contrast media are injected into the artery to confirm whether there's a stenosis around here. For example, if a renal artery aneurysm is diagnosed, a PTA, percutaneous transcatheter angioplasty, may be performed. During this procedure, radiologists may use inflatable balloon to expand the narrow part of the artery, then implant a mesh stent to create a passageway in the artery, making sure the kidney to get enough blood supply. Now this is an angiogram of the liver. What they established in the interventional procedure for cancer treatment is transcatheter embolization. Take this image for example. In this case, the patient was diagnosed with stage 2 hepatocellular carcinoma or liver cancer. The tumors are resectable due to metastasis. Therefore, a minimally invasive embolization therapy called TACE, transartery chemoembolization, can be performed. Now, because the hepatic artery is the primary blood supply for liver tumors, the goal of the procedure is to deliver chemotherapeutic drugs or embolization material to selectively cut down the blood supply for the tumors, so that growth of the tumor can be slowed down and eventually be cured. In this case, the patient will inject with the Libiorto mixed with doxorubicin, which are common embolization materials for cancer treatment. Now, in some cases, the chemotherapeutic drugs can be replaced by radioactive microspheres like yttrium-90 microspheres to selectively radiate the tumors and leaving healthy tissue relatively unaffected. Such procedure is called SIRT, selective internal radiologic therapy. The PLX7100 is also capable for performing non-vascular interventional procedures. The most common and frequent application so far is the image guidance in gastroenterology surgeries. So as you can see, this is a URCP procedure with gallstone extraction. It combines gastrointestinal endoscopy, as this one, and with X-ray
to treat problems at the bowel and pancreatic ducts. We also extract the stones out. The anal scope is the first to include mouth, advancing through esophagus, and then deliver at the duodenum. Then sending a balloon to expand the major papilla via catheter. The stone basket is later entered the common bile duct through the papilla to extract the stones out. Please notice the contrast agent is injected to confirm the obstructed bile duct is clear. Now the image is just received from Branch Hospital of Nanjing Wulou Hospital. It is one of the largest comprehensive hospital in Nanjing, which is also a long-term business partner of our company. Take this gastroenterology department for example. It is recorded that an average of 200 cases of ERCP procedure can be performed every month. Now other non-vascular interventional procedures including PCNL, percutaneous nephrectomy for removing kidney stones, or neurolysis for the treatment of neuropathy can also be available as surgical option. Now in addition to the clinical use mentioned above, the 71,000 has available to participate in the orthopedic service. For example, when it comes to treatment of spinal deformities, scoliosis, or degenerative disc disease, the 71 can be used for bone imaging and precisely targeting the implant position. You can see we have a pedicle screw emplacement at L4 and L5, both at lateral view and AP view. This is a case of a vertebral fasting, and this is the process for the cement injecting.
Alright, thanks for watching, and that concludes our demonstration of the CR7100. If you have any questions, please feel free to consult with our sales team. Goodbye.